Dr. Carl DiRaimondo, and I'm an orthopedic surgeon with Orthopedics and Sports Medicine BayCare Clinic. Knowing full well that when you practice in a community like Manitowoc, Two Rivers, you're going to see a variety of orthopedic problems. My interest coming into practice was sports medicine and still is, where that's a lot of treatment for athletes, whether that's collegiate, whether that's high school, whether that's weekend warriors, particularly shoulder and knee conditions. But also we do a lot of arthritis surgeries, so I do a lot of shoulder replacements, hip and knee replacements, and then a lot of stuff in between, whether that's fracture care, some simple hand procedures and otherwise, but it's a wide variety that we were able to provide in that community. For us in orthopedics, they're seeing us because they have a problem that's affecting their quality of life or their function, whether that's an athlete, whether that's someone just doing things at home, whether that's someone at work who's had an injury. So it's all a common theme. There's a problem, whether it's pain, whether it's stiffness, whether it's an injury of causing some damage, or through treatment, a lot of it surgical, but a lot of it non-surgical, that we can correct that problem, resolve their symptoms, we restore that quality of life. The most enjoyable part about our practice, of orthopedics is having a patient come in, whether that's due to an injury, whether that's due to arthritis. They're obviously limited in their function. An example would be someone who has an arthritic knee joint and no longer can walk their dog. And we work through whether that's non-surgical or eventually surgical treatment to include a knee replacement. And as they come through that recovery, they're able to get back out and do the things that they want to do. Obviously, it's very satisfying as an individual to be able to provide those services, but then also to see that person thrive after they go through their recovery. When I'm not practicing orthopedics, I'm spending time with family. And whether that's at home, whether that's on the water, on our boat, on the lake, it's trying to spend as much time as I can. I've had the pleasure of being able to be around my two children as they've grown up in our community. Now they've moved on to college or soon to be beyond. So it's now taking time to, spend time when they're in town and to get to them when they're out of town and spending time with the family.